Hey, I was about to say good morning, but it is now officially afternoon. So good afternoon. My name's Trey. This is Andy. We're AmbiHealth. We're really excited to be here.
The
Clicker, it's important. So I don't need to tell a room full of emergency physicians how many interactions you have with patients on a daily basis. Pretty sure you know that. But if you didn't know, there were over 600 million interactions between patients and providers last year alone. Yet healthcare still hasn't become intelligent. The fact that in 2019 someone can log in to go online, share an insane amount of data with the click of a button, but we can't do that with healthcare is, I think, really sad, and it's a problem. So let's look at a few examples of how, frankly, dangerous this can be. And these are personal examples witnessed in my very short career thus far. You've all had this happen. 3-month-old shows up in your ED sick, except this kid has a complex genetic condition and a care plan of specific things that need to happen in a very precise way in order to save this kid's life. That care plan, mom's carrying it around in a book bag. It's a thick, hardbound notebook. Another example, 30-year-old, new to your city, just moved here, ends up in your trauma bay, victim of a car crash. You would never know he has diabetes or a latex allergy because he doesn't wear a medical alert bracelet. And a more sober example, an 87-year-old traveling on the other side of the country, falls acutely ill, worsens, ends up in the ED obtunded. She gets resuscitated, intubated, sent to the ICU. Unfortunately, you find out days later she had advanced directives, DNR, DNI.
Yeah, and unfortunately, the issues aren't just on the patient side, right? Can you hear me now? We had questions about the lapel, so we got it. You want to do this one? Maybe crank that up, then they can hear me. All right. So unfortunately, the issues aren't just on the patient side. We have major issues on the provider side as well. So a couple of examples, urgent care chain. 3 years in, they bought a specific urgent care EHR, but they had to buy separate systems for comprehensive care. So for check-ins, for patient education, for charting, they had to buy separate systems. The standalone ER, for example, have zero association with 3 local hospitals. They invested millions in an on-premise EHR, and yet they're still somehow having issues with meaningful use standards, which is incredible despite all that investment. These small urban hospitals also investing a ton of money in these on-premise EHRs, but a lot of them can't afford the ED-specific features. And what's scary is a third of the folks coming through their door are complete strangers. So the reality is that the environment is fragmented. EHRs are often unsatisfying. There's a ton of them, and they're not interconnected. Patient portals are often siloed, often limited use when you talk about patient portals. HIE, despite a $600 million investment, we're still somehow talking about outdated infrastructure. One of the common themes, we've met a lot of people over the last few days, and there's been one common theme that most of the folks agree on. Most of the folks, maybe not Epic, but most of the folks we talk to agree on, which is the market is ripe for disruption. And that's incredibly exciting. The healthcare IT market, we're talking about a $40 billion market cap, $23 billion market cap when we talk about the EHR environment. Cloud-based EHRs make up about 20% of the market right now, and that's appropriately on the rise, but there are some issues there too. Customization, some real issues with pricing transparency, and then patient portals are trapped.
So what we're trying to do here at AmbiHealth is we want to declare a new health IT, healthcare intelligence. So how are we going to do this? Well, 1, we're going to integrate and automate care. 2, we're actually going to make health data smarter. And finally, we're going to improve patient engagement. So we've acquired an EHR that we're tearing down and building from the ground up to communicate bidirectionally with discrete parts of the healthcare ecosystem that don't communicate with each other. Then, only after patients authorize a transfer using secure role-based access protocols, AmbiHealth can share their health information in real time at the point of care to improve care for that patient. This places health data at the center of the ecosystem, meaning we're better positioned to improve patient outcomes. So what would this look like for patients? Well, it'd be easy for them to store and access their information anywhere, anytime, anywhere in the world. They'd be able to communicate that information quickly and at the point of care. And finally, we can better engage them in their healthcare. By participating in our modules that are available in our system, patients will be able to interact with their providers in a really unique way. And what would this look like for providers? Well, our system is super accessible. You can go from having no EHR to a fully functioning EHR in minutes and not months. You can access records irrespective of origin. You can integrate this system into your EHR or use our full suite of features to really unlock the potential of your practice. And finally, you can improve your practice, save money, save time, and become more efficient. If you look at the target markets, it's clear 42 million people, patients, could benefit from this system immediately, and countless more. Not to mention the over 500,000 still independent providers out there who are looking for a system that works for them. And this system isn't just for doctors, this is for physical therapists, dentists, anybody that's providing care, chiropractors, doesn't matter. Our system is truly scalable and universal because we're trying to solve the fundamental problem in healthcare, which is fragmentation. Our sole focus is to improve the bidirectional transfer of health information by creating the world's first digital healthcare ecosystem. And it's not just an EHR. It's a platform where all members of the healthcare team can meet to collaborate to improve care.
Bottom line is this, whether it's us or anybody else, the fragmentation is really dangerous. 2020 is a few months away. There's no excuse. There's no reason we should be talking about this still. Somebody has to step up and solve it, whether it's us or somebody else. We plan on being one of those that do just that. We have one goal, and that is just to make healthcare smarter. Thank you.
Thank you for your presentation. I think everyone who practices medicine agrees that there could be more and better in this space. So thank you for your efforts. My question has to do with, you said that the patient themselves have to initiate the transfer of the information, but one of your earlier examples had to do with advanced directives and a patient who didn't know.
Yeah, so sorry. I thought
Yeah,
there was
go
more to
ahead.
that. So, yes, great question. Glad you bring that up. So there will be a way for patients, or for providers, to override and to click an emergency button so that they can access the information. If they find a card in their wallet, they're wearing a bracelet. We're hoping that in the AmbiHealth, the emergency part, that we could hopefully get our QR code in there somehow. But the emergency provider will have to click a button verifying that he's going to override it. And in that situation, you'd be able to access their information, and the person's emergency contact would be notified with the location where the emergency override was done, so that they can find out if they weren't aware what's going on and what happened.
So have you successfully implemented your platform yet, or is this it's still in the development phase?
Still in the development phase. We have the EHR. We're currently rebuilding it, so it's probably within the next 8 months, we might be ready for some certifications and some testing. The patient app we're hoping to have ready in the next 6 to 8 months.
So, and then you know, in your presentation, you were talking about how kind of the impression I got was more of an out-of-the-box kind of ready-to-roll electronic health record. Traditionally, a go live takes 3 to 5 years of planning. So how do you have yours be a one-size-fits-all solution for practices? So
it's another good question. So it's not going to be a one-size-fits-all. Part of the customization is actually putting your specialty. I'm a pediatrician, and my wife's an anesthesiologist, and obviously we have a lot of ED docs here. All our practices are totally different, right? Y'all care about different things than I care about. My wife cares about totally different things. So we're going to start with the urgent care ED sort of context and roll it out in that sense. And then as we go, build other contexts for other specialties, other providers, dentists, physical therapists, things like that. So, thank you.
Thank you again for this presentation. Of course, fragmentation is a big problem, a big frustration for a lot of us. You had mentioned something about integrating into the EHRs, and have you made any inroads into that already? Have you spoken to any of the big EHR companies? 'Cause that's a big problem, right?
It is a big problem, yeah, and obviously we know Epic's not going to shake our hand right away, but we haven't quite yet. We're waiting to get the actual platform up and running so that we can actually have a repository where we can have data before we try to actually start getting that data. But that's going to be working with some of the medium players, smaller players first, building our way up. Really kind of pushing this more from the patient aspect first to get some data on board, and then feel like we're going to make our inroads into practices and with other EHRs. So.
Just a second question. So a lot of when we have these apps that are outside of our normal workflows, patients, providers, it is a second step that we have to do. So what is your plan to have patients sign up for it, adhere to it, keep up with it? Because that tends to be a bit of a problem with any of these digital solutions sometimes.
Yeah, and that is the issue. That's the main issue with patient portals, right? Is it's hard to get people engaged and actually on them. But I think a big part of that problem is they know it's not useful outside of that practice, that it is very limited. And a lot of them don't have a lot of functionality. They aren't very user-friendly. And our system is designed to be completely intuitive, as easy to use as Facebook. Like if you can get on, make a profile, like you can handle it. So, and I think that aspect of it will be really attractive to patients, and the fact that it's portable. They can take it anywhere in the world and have their health information shared very easily.
All right, thanks, guys.
Thank y'all.
AmbiHealth.